And we're back now with DC Today here on BNC. The CDC, Center for Disease Control, has determined that most healthy Americans do not need to wear masks indoors. The agency's decision is based on metrics of hospitalizations and COVID case numbers. And now the governor of New York will no longer require children to wear masks in school. But parents can continue to send their kids to school in masks if they choose to do so. Harvard Medical School professor of emergency medicine, Dr. Ali Raja, joins us now to discuss all the issues related to COVID. So, Dr. Ali, it's good to have you on. Does this mean we're in the clear, or is the pandemic still around but coming to an end?
Kelly, it's a great question. Neither, unfortunately. We're not in the clear yet. We still have cases of COVID, and we are in a lull more than anything else. And the pandemic, unfortunately, is not coming to an end. What we've found is that vaccinations work. And thanks to vaccinations and a lot of the precautions that we've all been taking, we have gotten the Omicron surge down to a point where it's manageable and hospitals have capacity. And so what the CDC's done is they've actually looked at metrics like not just new cases, but also the proportion of cases that are filling hospital beds and how full our hospitals are. And with that, they've decided that we're at a point now where we can not wear masks for now. But the key is that we may need to again in the future.
You know, a very good point, because as we're moving, I guess the better word is moving towards perhaps an end to COVID not being a crisis, but still being around us. Let us not forget, however, that more than 900,000 people have succumbed to the coronavirus, and we're still experiencing many cases daily. So that should be a stark reminder to each and every one of us to be proactive, should it not?
It really should, Kelly. We tend to think of these things like a pandemic as an on-off. We're not off, we're not on. We still have thousands and thousands of patients who are hospitalized, thousands of new cases every day in every state in this country. We are at a point where we have gotten through this surge, but those of us who have been following this and those of us who are treating patients on an everyday basis know that we're likely to see another surge. And the way we get ready for that is to continue to vaccinate, continue to increase our testing capacity, and then be ready when the numbers start rising again to do things like wearing masks again. We're at a good place right now, but we have to remain vigilant.
Duly noted. I hear you loud and clearly. I think it bears repeating from you, Doctor, because as you know, the numbers for people vaccinated and boosted is getting better, but we still need to be more proactive and remind people why it's necessary to receive those vaccination and booster shots. There's still some disinformation out there, and there are still some people willy-nilly going around believing the hype about misinformation and exposing themselves and others to possible COVID infections.
You're absolutely right, Kelly. There's a lot of disinformation around, and we're also getting more evidence as the boosters have been around longer. For example, there was just a couple of studies ago published last week in the New England Journal of Medicine that showed that the immunity that you get after you've had COVID with a booster shot is actually much better than the immunity that you get after having COVID alone. And that cases of people who had a booster on top of their prior COVID were far less than patients who just had immunity through COVID alone. And as we learn more and more about these boosters, we learn that to truly consider yourself vaccinated, we now need to think about not just the primary series, but also a booster. And that's why I have to tell you, I think that it's the right time to be dropping mask mandates, but I'm really a little disappointed that a lot of cities, including my own here in Boston, are getting rid of the vaccination cards that are necessary to go into bars and restaurants and movie theaters. The vaccine mandates are what got us to a place where we beat these surges. And by getting rid of the vaccine mandates, we're going to de-incentivize people, or at least not incentivize them, to get boosted. And that's what we really need to be focusing on.
Yeah, you know, that you mentioned that puts people in harm's way, if you will, because we don't know who's vaccinated coming into restaurants. I was recently carded going into a restaurant. They wanted to be sure that I had my vaccination and that I was boosted. That is so important. And actually, it provided me with some peace of mind to know that people in the room
You're right.
went through the same thing that I did. And it just gave me peace of mind knowing that I could go in there, have a great time with my family, and leave without any fear of being infected. But on that note, California Governor Gavin Newsom is changing, as you know, that state status from pandemic to endemic. What's the difference, and is he premature in doing this?
He's not premature. The difference is essentially that now, when you're in an endemic, this is something that is much longer term and that it doesn't overwhelm hospital capacity. And it's something that we learn to start having to live with, essentially. That's what it means for us on a daily basis. I think that that definition is fine as long as we understand that we may find ourselves in a pandemic if we surge again. If we don't surge, then maybe all this is for naught. But I'm pretty confident that given the fact that the majority of the world is still in a situation where most of their population, including ours, is not vaccinated, we are going to see new strains, we're going to see new variants, and one of them may end up being very contagious, just like the Omicron variant was.
You remind me of my grandmother giving that kind of advice that wasn't based on science, but based on her wisdom. What is it? Of uh,
So,
an ounce of prevention is worth a pound of cure.
that's absolutely right in this case.
Doctor, appreciate you joining us this hour. Always good to have you on to share this insight. Harvard Medical School professor of emergency, Dr. Ali Raja. Thanks for joining us.